everyone. I'm Dr. Erin Katribe. I'm a veterinarian and I am Medical Director of Best Friends Animal Society. Today, I'm here at Palm Valley Animal Society, and this is where I am embedded through the Best Friends Embed program, serving as their medical director. So Palm Valley Animal Society is a large high-intake shelter in South Texas. We get in about 30,000 animals a year. Right now, we're standing at the back of the 5-acre property, and you can see these kennels right here. So these kennels are what's called our urgent kennels. What is so amazing about the way these kennels are right now is that there's only a tiny handful of dogs in them. These are kennels that are just that. They're for dogs that urgently need to get out of the shelter, either because they're sick or they have some injury. What's amazing, one of the silver linings that's happened now during COVID is, like many shelters around the country, we have reduced our intake only to those animals that really, really need our help. And that's actually allowed us to focus more resources on animals that are harder to save. So animals that are injured or are sick. And that means these kennels back here are nearly empty. So in 2017, so just a few short years ago, the save rate here at Palm Valley was only about 30%. So out of 30,000 animals that walk through the doors every year, and to put that in perspective, that's about 55 dogs and cats every single day, 365 days a year. So of those 30,000 animals a year that came through these doors, only about a third of them made it out alive. That has drastically changed through the amazing life-saving work of Palm Valley staff and through the support of organizations like Best Friends and Natties, and through your support. So today I have something super exciting to share. So behind me you can see this room. This is, just as it's labeled, right now it's called the euthanasia room, and it is the unfortunate place where many animals did lose their lives. But today this room serves a much different purpose. It's the room that the medical team out of Palm Valley Animal Society's Trenton Center, where we're at, it's the room that they work out of. So it truly is the medical hub for this center. And today it's not a euthanasia room, it truly is a life-saving room. So something that's super exciting that I wanted to do with all of you on Facebook today is actually replace that sign with a new one. So unassuming, very practical sign. I thought about trying to call it the life-saving room. In reality, this entire shelter is a life-saving room, right? So we'll go with practical, and we'll go ahead and replace this sign. So I started coming to Palm Valley about a year and a half ago, and that's about the same time that Best Friends got heavily involved. And as I said, we've come so far. So from about a 30% save rate to this year so far, between January and now, tracking at about an 88 to 90% save rate, depending on the month. So much amazing life-saving work. We've come so far. So come with me, let's walk through and look at some cats. So these 3 rooms are our intake rooms for cats. And you can see where are all the cats. So through the implementation of a community cat program that started in June of last year, almost instantaneously we were saving the lives of hundreds and hundreds of cats that we would never have been able to save the lives of before. And so that's why all of these kennels are empty today. We do have a few, and so in this room we do have some of the cats that we do have. Not surprisingly, it is the start of kitten season here in Texas, and so we do have some neonates and then some adult cats in here. So let's talk a little bit more about our embed program. So why am I here? Why am I embedded as medical director down here at Palm Valley? As you can imagine, as our save rate increases and we get to that last 12, 11, 10%, the cases and the animals that we want to save, a lot of them are medical cases, and so they're harder. This shelter, up until I got here about a month ago, only had a single veterinarian for 30,000 animals a year. And while Dr. Lisa Rodriguez is absolutely superwoman and has an amazing team to support her, it's a lot. And even though we were at 88, 89, 90%, we knew we could do better and save more lives. And so that's why I'm here, embedded as medical director. And my role is to help support medical and put in place programs and protocols to be able to save more lives. One of the other challenges at the shelter and in this community, unfortunately, is a disease called distemper. Some of you may know about canine distemper. It causes respiratory and neurological disease in dogs. And in some cases, it absolutely can be fatal, but in a lot of cases, it's not. However, it's really, really challenging in a shelter setting. And up until very recently, unfortunately, we weren't able to save the lives of distemper dogs or even dogs that had been exposed to canine distemper. We do have a vaccine that works, but it takes a good 2 weeks to become effective. So even dogs that were getting vaccinated right away weren't protected in their time in the shelter. So we knew that that was a big chunk of that 10% of dogs that or animals that we wanted to be able to save. And so I would like to introduce you to Jennifer. So she is also a medical vet. So she is a best friend staff member. Jennifer, talk about what you do back at home and tell us why you're here.
Well, I'm a vet tech back at Best Friends at the Animal Sanctuary in Kanab. I work with the dogs and the puppies. Here, I am here to basically learn their distemper exposed and see how things are working and try to generate, implement protocols to be able to do more life-saving for these distemper kids. And as I leave, I'll be able to still work with Palm Valley and try to save more lives.
Yeah, so what Jennifer and I have been working on is protocols that really look at some of these distemper exposed dogs and do a risk assessment and see, do we think that based on their age, based on their vaccine status, do we think they're going to get sick, and do we think they're going to get really sick, or are they protected, and start saving those lives. Eventually down the road, we'll get to a place where we can even start saving as many of the distemper dogs as possible. Jennifer and I both were deployed during Hurricane Harvey in Best Friends Temporary Response Shelter, and we did have a distemper outbreak. Of over 100 distemper dogs, we saved over 93% of them. So for a disease that I was taught in vet school was absolutely fatal and don't even bother to treat, we know that's not true. And so my goal long term is to get Palm Valley to a place where we can save those lives too. Right now we're starting with the ones that are easier, and just increasing that life saving in any way that we can. So the other thing that I wanted to share with you today is how the shelter, like many shelters across the country, we've changed our operations in order to still do life saving in this time of a public health crisis. One of the most obvious ones, we're all wearing masks, and I hope that you can hear me. Like many shelters, as I mentioned earlier, we've reduced our intake to only essential intake by working with animal services. And that has allowed us to dramatically reduce the inventory and the number of animals we have in the shelter. What that lets us do is reduce the number of staff that we have here every day, and that in turn reduces people's potential exposure to COVID. We know this is a disease that's spread from human to human, and so if we can reduce that, then that benefits everybody, our staff and the public and the community. However, that does not stop life-saving. What it has allowed us to do, though, because we don't have as many animals on site, is we have been able to really focus on those distemper dogs. We treated our first parvo case a couple of weeks ago. Super happy story. So this puppy, her family didn't even know that she was lost. She came into the shelter as a stray and ended up with parvo here. When she came in, we were able to treat her. Before, the only outcome for parvo dogs was to get pulled by a rescue group. But we were able to treat her in-house, get her healthy. We posted her on Facebook when she was ready to be adopted, and her family came forward and they reclaimed her, and she went back home with her family. And it was such a happy story. So the silver lining again to COVID is that we get a chance to really implement some of these programs that we weren't able to implement before and save lives that we haven't been able to do. Other things that we've changed, so similar to many shelters as well, we're still doing adoptions, we're still doing foster, we've just changed the way that we've done it. So adoptions by appointment. again, to reduce that human-human exposure. We're even doing curbside delivery of pets that are already adopted or fostered, or even home delivery. And so engaging our staff that don't have as much work in the shelter to really go out into the community and be able to support that life-saving. So what I would say is we can't save these lives without your support, without the support of best friends, and without the support of the community in the Rio Grande Valley. Life-saving doesn't stop because of a public health crisis, and so we need your support. If you're down here in the valley, come down, give us a call, adopt, foster. If you're not, support best friends and support Palm Valley, because remember, it's together we can save them all.